again. So we'll be presenting today about evaluating COVID-19 transmission, the City Disaster Vulnerability Index. My name's James Daniel. I'm a disaster risk analyst at Disaster Risk Resilience Analytics and Solutions, KSB at the World Bank. And I also have Tony and Rashmin who will be taking you through the City Disaster Vulnerability Index. But other members of the team are also present. So Kerry, Josh, Oscar, Sam, Benji, Maria, and Graham. And they've also worked on this and will be available for the question session as well. So you may have been in the previous session presenting the LAC risk viewer. Now, well, risk metrics and information, they come in various forms around the world, and we attempt to provide sort of innovative solutions and tools where issues arise. And of course, centralized and national portals are, of course, good for certain applications, but a huge amount of information is available at the subnational level all around the world. And so this needs to be often compared cross-border, cross-city, cross-country, and in various applications. And so in the case of COVID-19, World Bank TTLs really needed to know what was going on. And so as the subnational level data sort of becomes more and more accessible, vulnerability indicator tools become more and more important because this provides decision makers with quick analysis of the issues and to be able to weigh trade-offs. And so although we've used this in COVID-19 and in the pandemic, it's actually a universal tool for assessment of disaster vulnerability indices, and it can be used at various scales. Of course, we've shown this at the city level across various cities across South America and Latin America. But sort of the 50 to 60 indicators that have been used at the sub-city level have been used across different cities. And so my colleagues Tony and Rashmin will get into this. Next slide, please. So just sort of how we're going to be going through the day. I'll take you through the subnational COVID-19 pandemic data that we've collected and that we've been updating and show you how this works. And then we'll get into the CDVI and the CDVI tool. So this City Disaster Vulnerability Index tool. So I'll now take you through. So if you could stop sharing your screen, please. Thank you. Then I will take you into the COVID-19 Latin America viewer. So this sort of shows the current state of the coronavirus pandemic in Latin America and Caribbean at the subnational level. Now, South America, why sort of Latin America and Caribbean? Well, firstly, it's been one of the worst affected regions. Now, there's been about 65 million cases across the globe, about 1.5 million deaths so far. Now, Latin America and Caribbean has about 8% of the world's population, yet they have 20% of the COVID cases and around 30% of the deaths. And obviously, as a proportion, this is the most affected region, although Europe is obviously catching up fast at the moment. And it's extremely important, therefore, to understand what's happening, not just at the country level, which a lot of sort of the COVID statistics websites and whatever show you, but then at the subnational level and at the sub-subnational level to really understand the processes and understand what's going on. So what we've done is that we sort of started looking at a very, very granular level, and this supports governments in hopefully containing and also understanding at least sort of how to implement measures, but also it integrates for sort of the people who are trying to get an overview across countries or across borders, a view at still that subnational level. And so we looked at various metrics as of course, a lot of the COVID statistics are: active cases, 7-day cases per 100,000, because this is sort of a really good metric in terms of relative to population, where is the disaster going, or where is COVID going? And then we've looked at testing rates and also death rates and so forth. And so this is all in a portal and updated as we go. And so there's about 570 units or so across Latin America and Caribbean. Of course, you will have seen data around the world from JHU and so forth. Now, this doesn't have all of the subnational units, and they're often aggregated from aggregated websites. So there's often errors in this data and issues with it. And so it's very, very important that we get the right links from the right subnational units. And so say in Brazil, there's actually a link for each of those points where this data is collected. And it's extremely important to do this because otherwise you end up with errors. If we say zoom in to somewhere like Lima, if this is working, luckily I've sort of prepared other ones in advance just in case it doesn't work. The internet connection here is not the best at times. So here, when you zoom into a certain location, say like Lima, you then have your active cases. You'll have your 7-day cases per 100,000, which at 43 cases, it's gone down a lot since sort of the peak of it. And we can then also normalize this by testing, and we can do this across each of the locations. Now, why is this sort of important? Well, you can also then start comparing cities. You can start comparing measures that are taken. And you can even drill down further inside one of these points using a lot of the open data that's around the place. Now, in Bogota, for example, the data at the localidad level sort of allows policymakers to really understand the spatial and temporal spread of COVID across the city itself. And so it allows for identifying the hotspots for transmission and economic recovery, as well as to sort of map areas of concern. Now, of course, we have this singular value again for Bogota itself, aggregating all of the city. So at the moment, there's 21,000 active cases, and they're at a rate of about 176 7-day cases per 100,000, about 4 times Lima at the moment still. But as we sort of zoom even further down, we can start seeing trends across the city. So if we focus here on this red line of Kennedy, Kennedy is out to the west of Bogota. It is in a poorer socioeconomic strata, and it was the worst affected through the first part of COVID. So we saw a lot of cases occurring because a lot of the working population was coming across the city and then coming back again. And so being able to have these statistics every day from the laboratories and the open data networks across other cities as well, this allows us to really sort of like for like check what is being done in these locations. What is the value associated? What are the case rates? What are the death rates? And then see also what can be done. And so all of this information obviously is extremely important. Another district, for example, Suba, it wasn't as affected in the first part of COVID, but then obviously something happened. We don't necessarily know what. And they had a lot higher case rates, and now it's stabilizing to about the same rates as Kennedy. And so by then going into the the city disaster vulnerability index, this then allows us to maybe look at some indicators that may be explaining some of this. And so now I will hand across to Tony to then go into this. So I'll stop sharing screen.
Thanks, James. Rasmin, can you share screen? And actually, it's Rasmin who is going to take
over. Rasmin. Doing well. Okay. Good.
Then it's me.
Doing well.
Rasmin, please share screen and unmute.
Okay. So can you see the screen now?
Yep.
Excellent. Thank you. Thank you so much. And again, apologies for the delay. So building on what James explained, we need to kind of look at, okay, there is a kind of this time history that has been collected to the subnational dashboard that James was actually explaining for the Latin America and the Caribbean region. But then if you want to drill down into some of the causalities and what the implications are, we can then look at using a tool such as the City Disaster Vulnerability Index to further analyze what those causalities and what are the implications are. So first, I'm going to highlight why, what, and how can the disaster vulnerability or the City Disaster Vulnerability Index actually help end users, right? So first, looking at the why, there was a lot of interest even before the pandemic to better understand the vulnerabilities at the subnational level and what's actually driving them, the causalities, and better understand some of that underlying components and the drivers of vulnerability during disasters. This could be useful information not only to disaster risk managers, but also to territorial planners, health professionals, for example, as well. So it then supports the decision-making process. And when COVID-19 came along and we were identifying cities as big hotspots of activity for COVID-19 transmission, there was also this request to how can you better support decision makers to balance COVID-19 transmission and economic recovery, right? Even at the national level or at the city level, this is one of the fundamental questions that decision makers are actually grappling with at the moment. And there is growing demand at subnational level in Latin American countries to get this type of information. The third part is once you do that analysis, how can it support intervention measures across different sectors? So it could be related to emergency response, it could be related to health, it could be related to disaster risk financing or poverty, for example. Okay, and now I'm going to explain what the City Disaster Vulnerability Index is. It effectively quantifies the assessment at the sub-city level, the vulnerabilities of different types of shocks, be it from earthquakes, floods, hurricanes, etc. But to understand all of that, you need to understand what the actual exposure is. And this exposure or the associated vulnerability for that exposure could be linked to 4 different pillars. And those are urban fabric and the business side that we call enterprise, the government side in terms of public administrating and governance, and then the human dimension, right? For each of the different pillars, we have different components. So these components, for example, if you're looking at urban fabric, could be located in terms of space, the geospatial component, or in terms of accessibility. And we also identify for each of these components different indicators. And these indicators could be related to public interaction, density, urban diversity, for example, access to communication, water and sanitation, electricity, public transport, etc. And from a business perspective, it can also relate to economic activity, formality, and also physical assets. What type of buildings are distributed across the city? Who's actually living in them? What is their economic viability? What kind of non-residential structures are there? What kind of residential structures are there? But also in terms of diversity of the economy. For example, in the Caribbean, there's a big dependence on tourism. But in some of the other countries, it might be the business size or the firm size that you need to be looking at. From a government perspective, it also is depending on the institutions or the services, right? In the services sector, we can be looking at directly our counterparts from the World Bank side, who we actually deal with from the health sector, education sector, solid waste, emergency management, etc. But you're surely realizing that all of these different users would have different interests as well. And that's where we need to have the flexibility in the City Disaster Vulnerability Index to integrate that. And I will come to that in a moment. But one common thing is the impact of the people. And those kind of components then relate to kind of the social side, the health side, economic, the physical side in terms of buildings, age, etc., but also inequality as well. So then I'm coming to how can this really help, right? So the City Disaster Vulnerability Index has been done in several LAC cities, and it's started off as a proof of concept and getting a lot of traction. But the outputs, there are actually myriads of different uses. Some of them we actually link here. So one of them is looking at sub-city data sets that provide absolute and relative factors to integrate into a range of different applications. And for example, we can look into Lima, Mexico City, Bogota as well. And in this case, because of the prevalence of COVID-19, we make a specific focus. But I really want to reiterate that the City Disaster Vulnerability Index is not purely focused on COVID-19. It is also applicable for lots of other disaster-related events as well. But if you are also thinking more from an end user's perspective, what's really useful is how can I then use it, right? So we developed a decision support tool, an interactive decision support tool. And this is increasingly being used or has increased interest in at the city level as well. And this then complements the point that James was making before in terms of informing city-level disaster risk profiles from a residential perspective, as well as from a non-residential perspective as well. So I'm just going to give us a quick snapshot of what the tool does and what it's really trying to achieve. So as I mentioned, it's an interactive tool that supports exploration of data different across many sectors and contexts. And what it also does is that it allows you to change the weights, because if I'm a disaster management specialist, my focus might be different than if I am, say, a health professional or if I'm an urban planner, for example, right? But we also need to stress test our index and look into what if scenarios. What if a particular earthquake were to reoccur? What if a particular hurricane or a flood inundation impact were to occur as well? So then we can then use this functionality to also look at intersection with other data sets, right? And how it can then be used as a composite index with other risk profiles that James also mentioned just before. So this is actually the interface itself. Here, as I mentioned, we are looking at COVID-19 context. So we are looking at, say, health sector. And then we can actually choose the specific context that we actually are interested in. And that allows you to show all the different data sets relating to kind of transmission, relating to people's interaction, the public administration, the services that are actually going to be impacted. For example, the number of hospital beds by distance, or the number of students or teachers available. And it can also look at the people side of the social and the health aspects of it as well. For example, the proportion of people with existing medical conditions. And we can add these indicators. So you have a choice of over 50 different indicators that you can add depending on the sectors. And some of the cities we have looked into are, for example, Bogota, Mexico City, Lima, and also some of aspects of Buenos Aires as well. So this allows you to then choose and narrow down what the indicators, the city you're interested in, and the kind of the sector. And then you have all the choices of changing the weights that we were talking about as well, if need be. And then you can actually run calculate the composite vulnerability. And it's a very easy to use tool. And what it then does is that it also provides this what-if analysis. For example, if you have your composite vulnerability index, but then you say, okay, what is the impact on the composite vulnerability index if the floods from 2 years were going to reoccur now, right? And then it allows you to have these outputs in terms of exposure, in terms of the composite values itself, but those 4 key pillars in terms of people, public administration, business, and urban fabric as well. Okay, now I would hand over to Tony. Over to you, Tony.
Thank you, Rasmin. So in the following slides, I will show a few examples of, types of analysis that we have done and some CDVI outputs that we have pre-prepared. But as you can imagine, because there's 44 pillars and 14 different components and 55 indicators, the whole thing is very complex. So we try to pick up a selection of a few. And our particular focus when we kind of worked on it over the summer in the Northern Hemisphere, was that, how it could be useful in the early recovery phase for the cities that we were examining, and what and where should we focus. So this curve it was a curve that applied at the time, but you can imagine it for any different situation and different city. So you know that there was a gradual, very rapid increase of the pandemic, and then a flattening of the curve, and then the possibilities of different scenarios of reducing the curve at different success rates. So in order to facilitate the recovery phase through this CDVI tool, the use of spatial data is crucial, and because it is very helpful to help us understand how to support this recovery phase. For example, by reducing the likelihood of a second wave, or the duration or the time when it happens. And it involves understanding the points of increased transmission across the city. So, for example, where you have points or hotspots of potential transmission of the pandemic, and you are able to capture some of those, then that's very, very useful. Then supporting the most vulnerable obviously is a priority, because in order to do that, you need to understand who is most at risk from this. Obviously the elderly, but also the lower income people who will lose their jobs and will be struggling during the lockdown periods that in some cases were very, very, very long. And of course that is important then to design the recovery and the assistance policies, so that it makes the recovery best, or the least painful, let's say. Can we go please to the next slide, Rasmin? Thanks. So in order to do that, we need to employ a mixture of data, and a mixture of data from different data sources, from different portals and locations and reports. And also an important aspect of this is that some of the data are static and some of the data are dynamic. The static data, of course, always starts from the latest census and the statistical yearbooks information, and information from the relevant ministries, like from the Ministry of Education about the operation of schools, the Ministry of Health about the location of hospitals, the beds and the number of ICU facilities that they have, from tourism, the amount of loss of business that was there, from infrastructure, of course, to understand what is the infrastructure, how is the density of roads, what is the public transportation system, and so on. Then there are open data portals, for example, some cities have their own open data portals that are amazingly good. For example, in the city of Mexico, in the city of Buenos Aires, in Bogota, we found that they had excellent open data which gave you information about the location of a lot of assets, like the entire building stock, by the number of floors it contains, by the size of the building, by the type of use of the building, and also multi-use buildings with different types at different floors. So that kind of information is extremely important to understand, hotspots of population density, for example. Then, of course, the Human Development Index reports are very important, and other statistics sites, the official statistics like the INE in Peru or the DANE in Colombia, and so on in the other cities we looked at. We looked at condition de vita, kind of living condition surveys, and other kind of socioeconomic surveys, encuestas. And of course, we employed the global population layers, HRSL, GHSL, Landscan, and so on. And whenever there was lack of data on the building stock, we employed the OpenStreetMap data, the HOTOSM, and for the history of disasters and to understand what kind of disasters have affected these particular cities, we plugged into the CAT database that is developed by our colleague James Daniel. Then on the dynamic side, of course, with COVID, it is so dynamic. So we were accessing all the daily bulletins of COVID from at the national level and the subnational level. And then for the cities in particular, to understand people's movements across long period of time, many weeks and months, we plugged into Facebook and Google mobility data and cell phone data to see how people moved across the city during lockdown, how effective was the lockdown, or during different times of day or during different days of the week. So we will have a slide about that, a kind of dynamic slide towards the end. Next slide, please. So here is an example of, for example, how important for the COVID aspect. Obviously, we all know that the elderly are the most vulnerable. And this example just shows you a chart and a map. And it's for the case of the city of Bogota. So on the left-hand side, we see the bar chart, which shows you for 3 different age brackets, the blue being less than 15 years old, the orange being 15 to 60 years old, and the gray being 60 years and over. And it shows you the death rate as cumulative death rate. This is at a given point in time. It's kind of late May when the pandemic was really picking up speed in Bogota. And you see, obviously, you see the gray bars are much higher than the orange ones, and the blue are hardly visible. And we also noticed that within the elderly, there is a big difference. Why could that difference be from one district to the other? So actually the map is the bar chart contains 14 different localidades, which is like the admin level 3 of sub-city level. Like imagine it as a Bogota being a mega city, and it's got 14 municipalities under it. So on the map on the right, we see some of the boundaries of those municipalities in black, and then the layer actually shows us what is the proportion of elderly population, those that are 60 or over, down to the town block level, the manzana level. So for example, we see that a high proportion of elderly is in some localidades at the north and central and northern part of the city. And when we actually looked at the socioeconomic strato data, we found that also some higher strato neighborhoods of higher income population coincided with locations where a high proportion of elderly was there. So we could see, like at the beginning, for example, in one of the high income localities, Usaquén, and that's where the pandemic started, because a lot of people who were traveling abroad came in and brought the virus from other countries, and then gradually the virus spread into kind of across the city, hitting in particular the district of Kennedy. But we also saw that the underlying conditions of the elderly, or their underlying health condition, which we can get from other indicators in the census, was very important to explain the differences in this kind of why some of these gray bars are much higher than in other places. And it tended to be that the places which had lower strato had also this kind of a higher death rate among the elderly people. Then in particularly in Kennedy, there was of course the Cora Bastos, big Cora Bastos, a huge logistics center where it was the early place where it was a point of high interaction, because all the food that comes into Bogota came through the Cora Bastos logistics center, and there was a huge amount of cases spreading from the logistics center into the entire localidad of Kennedy. Thanks, Rasmin. Next, please. And then, of course, the plan continues, and we see, what we can do. And then more dynamic data become important as we move out from the lockdowns and analyze the patterns that internationally, we see some patterns of cases appearing in super spread facilities like processing plants. We understand public transportation networks are a big issue. Next slide, please. And I'm kind of rushing because we're kind of running out of time. Here we collected just a few kind of examples from the city of Mexico, where we can see, different socioeconomic indicators at the individual town block. So we see unemployment, we see the density of green space and other indicators. And we have a similar set for the city of Lima in the next slide. So, it's a kind of, this one is done at a different kind of resolution because of the availability of data. But, the idea is you get the idea. The green space obviously allows better social distancing abilities. The kind of informal labor is an issue that people have to go out more, and they probably are more vulnerable to many other factors, and also they cannot stay for long periods of time in lockdown, and so on. So there's many indicators in that process. And next, please. Thanks, Josh. And here we see that kind of the mobility. This is actually the Facebook data. It shows the city of Lima at a grid of 600 meters across the city. And we see for the period of 10 weeks, from May 1st to July 13, for every second day, like May 1st, May 3rd, May 5th, the movement in 5 hours duration preceding 7 p.m. So like business hours kind of thing. And when we run the video again, we can see this is frozen here in a particularly busy day, but we see some other days which tend to be the Sundays. The amount of mobility is much reduced. And then of course during the business days there's quite a bit of mobility, despite the fact that there was actually during those weeks there was a lockdown taking place, and in some places also there was quarantines in some neighborhoods that were very badly affected. Yes, and the next slide is kind of like to conclude that basically we repeat that what we've done is that we've showed you the interactive tool of the subnational data for the whole of LAC region, 44 countries. We explained the CDVI and why we developed it and why we think it can be helpful. We also have developed the country disaster vulnerability index for each city and locations within the city. Depending on the city, it can be done down to the manzana level or district level. And we have also developed exposure products that we didn't have a slide about that. But by that we mean that we have done the valuation of what kind of exposure in terms of local currency or international currency, what is the replacement value of the building stock and of the infrastructure that is there, so that it can be used for scenarios, earthquake scenarios or flood scenarios or other disasters. And we've shown you some examples and results from our tool and discussion, and all those kind of thematic maps, that there's hundreds and hundreds of those for us to try to understand. We also did quite a bit of work in an analytical hierarchy process to quantify and give proper weights to the different indicators. And yes, so we are at a stage where this DVI tool is ready. We have seen a lot of interest from the cities to employ this in various different applications, and we are thinking about this at present. And we thank you for your patience and attention. Apologies, we started 15-20 minutes late due to that technical problem. And maybe we can take questions and have the discussion now. So please feel free to put your questions in the chat. I see, Kerry, that we have 3.
Thank you, Tony. Yes, we have one question from Karen so far, and she's asking if the team can explain more how governments are using this tool. And is there a minimum city size for which this tool can be used? For example, is it only applicable really or useful for bigger cities?
Thank you. Rasmi, you want to take that?
Sure. Thanks, Karen, for the question. So if I go on the second question, it's not really depending on the size of the city, but more the data available, right? So because as you can see, there's a lot of granularity of data that's actually required. So if we can actually get some of that data, then it is actually possible to do that. And we see that, for example, in terms of mobility data, some of the Facebook data for some of the bigger cities, it's available, but not necessarily for some of the secondary or the smaller cities, right? So that is another limiting factor from that particular perspective. In terms of the government take-up as well, from the bank side, I would also say there's different sectors, right? So for example, there's different engagement, for example, with the health sector. Of course, there is a specific interest from the health sector to really look at this balance of COVID-19 transmission and economic recovery that we could actually look into. And in some of the countries, we already have started that engagement, and where they want to kind of really understand what the tool brings, but also what is the added value, right? What we are actually bringing in terms of some of the others. So, for example, the flexibility what the tool offers is a key ingredient, but then also for the health sector, this balancing between COVID-19 and economic recovery. In other cases, they've been interested more, how can this be scaled up in one of the countries? So for example, you would have noticed that the countries we were talking about are mainly capital cities. So they were interested in saying, okay, can we actually scale it up to some of the other cities as well? So this is something where we are looking to discuss as well. A third part is saying, okay, can we have a coarser model? Can we have reduced the number of indicators, but we consistently monitor across lots of different cities? So that's a third part in terms of where some of the specific interest has been coming from. Hopefully that answers your question.
Yeah, just to maybe add a couple of points that, for non-capital cities, it depends, the level of open data may be a bit less, but nevertheless, or the ability to analyze at the manzana level, the city block level may not be always possible. But the tool is actually dynamic in itself. It uses dynamic data, but it's also dynamic that it can have kind of different, resolutions. And like Rasmin said, consider subset of the 55 indicators if, some of them were not available. For example, in the city of Buenos Aires, there is for the recovery phase, there is a big interest to invest a lot of money in kind of tackling the problem of the informal neighborhoods. So, you know, there's like 10-15% of the population is in those barrios populares that are called. And, you know, we did a kind of specific analysis for that, where we mapped out and we analyzed them and created a database that was not there before, and submitted that to our colleagues there. Yeah, I see we have some more.
So as vaccines are being developed, can this tool be adapted to support this in any way, or possibly to support the monitoring and evaluation? So in terms of the COVID subnational and subcity statistics and the trends associated with them, you will be able to start hopefully seeing, once the vaccine comes in, you'll hopefully see drop-offs versus number of tests and things like this. So you would see it directly through the data, hopefully. I'll then leave it to other people to say whether it's possible in terms of the dynamic indicators for the subcity level. I'm not sure, but I presume that as we have more data coming in terms of the number of vaccines across the city, portals like Open Data Bogota and the Peruvian portals, and so there's usually an open data portal for each of these individual cities. And so often the laboratories will be putting up their data directly on there, and we can just then access it. And so I can imagine that we will be getting some indicators, which we can then feed back into the CDVI, which may be able to give us some indications on that level. But again, at this point in time, you don't know what's going to be actually released and what's not going to be released, and if we will see that trend. But that would be my sort of
yeah, it's quite likely that we will see those kinds of data, you know, numbers of people vaccinated by location, by age bracket, by profession, and so on. And then that can feed through.
Thank you.
One more.
Yeah, there's something about climate data.
If it is relevant, how climate data could be integrated into the analysis. So
yes, that's something we spoke in a previous session about to Yuriko. Thanks for the question. Yeah, we have kind of taken that into account through, you know, the kind of socioeconomic pathways, and you know, the projection of climate change in the cities for different increasing hazard levels. And James, maybe you want to take a bit of that.
So there's also environmental indicators associated within the CDVI. So there's a section on environment, and a lot of those indicators are inherently then put into the CDVI. So where there are already climate studies or climate indicators available for the city from the open data portals, they then go into that environment section. That's one part where they're housed. But then they also come into, I suppose, all of the hazard metrics and the metrics that are influencing also the CDVI itself from the opposite side. So yes, climate data can be integrated in, and probably already is, but yeah, Reshma?
Yeah, I just want to add a couple of points, because it's actually a very good question and very important. So one of two key points is that, one, we also try to make it not biased to one particular section or sector, right? So effectively what we try to do is do some statistical analysis, like principal component analysis, to make sure that we have an unbiased risk index. So that's one key point that I would like to raise. But it can be sector specific, you know, that as James was actually talking about. Another key point, and relating to the climate side, but also the geophysical side, is that we can then use this information along with some of the other work we are doing, for example, with building codes, right? So for example, are these impacts or the indicators translate to the design standards that the cities or the governments are actually proposing? And in terms of a future climate, what does that actually then look like? And this actually provides some very useful insights into the environmental and future climate impacts as well. Thanks.
Yeah.
Thank you. And are there any other questions? Since we started a bit late, I know we've gone a few minutes over. If there are a few questions, we can take those. If not, we can wrap up. Thankfully, the recording will be available, so we'll be able to share with people that weren't able to log on using the link at the beginning of the session. Okay.
Well, we want to thank those that persisted.
Yes, thank you.
Yes.
Because it must have been a struggle. Thank you very much.
Yeah, I just want to fully appreciate it for everyone who joined now, and yeah, it's truly appreciated. If there are any follow-up questions, please feel free to reach out to us. I believe the presentation is going to be available online anyway, that you could actually use as well. Okay, thanks.
Okay, thank you all.
Thank you. Bye.
Okay, bye-bye.